Bapuji Medical College, Davangere. He's also certified in pediatrics advanced life support, pediatric epilepsy training, neonatal advanced critical care, and he also has many achievements to his name. He was the first place holder in the state Karnataka Talent Search Examination, and also he secured third place in National Science Talent Search Examination, and also he has secured various ranks from the level of his PU until the MD Pediatrics, and he has also has 17 paper presented at national and international conferences, and he has also has been invited as speaker at different hospitals, and he has also secured different victorious places at first zonal level neonatology quiz, first state level pediatric quiz, second south zone hematology quiz. And with respect to his practice, he is the first pediatrician in Athani, Belgaum to start a ventilator neonatal ICU, double volume exchange transfusion, and surfactant theory. I'm very pleased and honored to have you as our speaker for today, sir. Handovering the mic and the session to you, sir. Thank you.
Thank you. Without wasting much time, I think let's delve into the topic at hand. Now that we have gone through the first and second surge of COVID, having seen so much of devastation, and we have seen so many lives being lost, I would really call that going to get affected in a similar way, then it is going to be the end of the world. So we're facing a very grave situation at hand, and the real difficult part is that we know very little about how to treat this. Since it is a new disease, very few people have the experience of treating it firsthand. More and more people are going to face this challenge sooner or later. So the only way we can get beyond this is understanding it thoroughly, implementing the principles, and moving ahead. So, dear doctors, budding specialists, please kindly pay attention, ask your questions, clarify your doubts, and let's understand how do we deal with COVID in children. Now, what do we aim to learn through this class? The first and foremost thing is, unlike the first and second wave, why there are more pediatric cases in the third wave? What are the symptoms of COVID in the small kids? How do we investigate them? What are the treatment guidelines? What are the things we're supposed to do and what is supposed to not do? And we'll do some myth busting. Now, I'll start with this interesting case scenario. My aim is to present it in such a way that this is small cases and we'll understand how do we deal with it. So this was a young kid, 4-year-old, my name Athav. This March, he was tested positive for COVID. His mother was also positive. He was quite clinically stable. We gave him simple treatment. He improved very well at home. Now, the real question was, both parents being doctors, they had this question in mind. Sir, the last time around, when both of my grandparents were affected, my grandfather died, but none of the kids were tested. What made you test him this time? Don't you think it's a very valid question? Dear friends, this question is in everybody's mind. Why are kids being affected more this time around? So, let's understand it. First of all, what do we know about COVID? While COVID means CO stands for corona, VI for virus, and D for disease, this is the 19th variant, so this is the novel coronavirus. Many of the countries have already experienced the second wave, some third wave, and few countries are also in the fourth wave. While in the first wave, elderly were affected, second wave, these young people were affected. So many without any comorbidities have lost their lives. Why is this so? Now let's understand. This coronavirus has a way of adapting itself. That is, it mutates, it changes its structure, it adapts to the atmosphere. You give him more and more difficult atmosphere, it adapts and attacks in a different way. So this new variant, B1617, has an affinity towards younger kids. It is more infectious variety. And we also know what happened was after the first wave, once we came across it, there was a laxity in the social distancing. There were all these parades and all the elections and everything, and the new cases started rising. Let's understand what actually happens in kids is these kids go out and play, indulge themselves in physical activities, and they really don't wear masks or they don't maintain the hygiene and protection measures what adults who understand do. But beyond all these things, today the most important cause for coronavirus in children is that the parents who go out, they so right now the most important cause is let's understand that on this field. And every day newer variants have been found out. There is a South African variant, there is a Brazilian variant, there is a Singapore variant, there is an Indian variant, so and so forth. Newer and newer variants are coming down. There is a kernel variant which they identified that it can cause dangerous disease in very few days. So as of now, it is identified that the new variants are having various pathogenicity. Some are weak while some are strong. Not that every new COVID variant is serious to children, but yes, some of them can be. Now, please understand that unlike the first and second wave, this second wave itself, there were close to 90,000 adolescents, 38,000 kids who are less than 10 years who are affected in Maharashtra in only just 2 months. How about Karnataka? Close to 40,000 kids were affected. Now, dear friends, please understand that this is just the tip of the iceberg. As we all know, lot of patients which are diagnosed are not being reported. So many patients are being treated by all of us based on clinical symptoms only. These are those 40,000 cases whose RT-PCR was positive. I think in my clinical practice, only these kids belong to only the 10%. So we might confident 4 lakh kids were affected only in the second wave. Now, please understand, if the third wave primarily affects the younger children, then imagine how many more cases could be at our disposal. Now, let's understand how this COVID virus spreads. Now, please, dear friends, understand that the COVID virus spreads primarily in the form of an aerosol or a droplet. That is, whenever somebody is infected, he coughs or he sneezes, they bring out this secretion and they tend to stay around. And those who are in a parameter of 1 meter, they tend to get affected. Last time around, we had told that fomites could be one of those, like if at all you touch a surface, and we used to practice extensive hygiene. But nowadays, it is identified that predominantly, most commonly, this is an aerosol-borne infection. Now, coming down to understand that how do we really understand which case is a COVID child? Please, dear friends, understand that it is quite complicated and difficult to diagnose COVID only based on symptoms. Why? Now, this case. He is a 12-year-old child, Master Akshaj. Both parents are engineers. They work in Hyderabad. Because of this COVID wave, they thought, let's be safe and come down to a smaller place like Athni. Came down to Athni, and Master Akshaj, he was a known case of allergic disorder. Every year around, he used to get cough, cold, sometimes breathing difficulty. He was already hospitalized 3 times earlier. Now, this time, again he came with the complaints of fever, cough, lethargy. In my OPD, we checked his saturation, it was 92. Let's understand, anything below 95 is something which creates an alarm. So, 92% saturation, child is lethargic. Then we asked the symptoms, typical of COVID, that is, does he have loss of smell? Then the parents told yes, but they told that every time during this present condition, he has this complaint. And we told, no, right now his saturation is just 92. They told that last time when he was admitted with this complaint, his saturation is just 90. So this was a difficult scenario, whether this was a COVID case or a case of allergy. Now, please understand, here we'll focus on what are the symptoms. Now, most patients come to you with the complaint of fever, cough, cold, some amount of sore throat, and a little bit of lethargy. So please understand, this kind of symptom group is something which is like 60% of your OPDs as a pediatrician. Now, a second variant which presents is with vomiting, loose stools, and stomach pain. This makes it close to 90% of the patients which come to pediatric OPD belong to these two categories, either the respiratory group or the GI group. These are the main ones, while the rest of them are rare. Now, it becomes a dilemma that you cannot investigate or label every child with these complaints as COVID. Now, there is a third presentation, that is, some kids only present with history of body ache, headache, generalized weakness, and they're just tired. So this is again a very trivial or some symptom which is quite very common. Now, very important point to understand is if the children are very small, say it's a 2-month-old baby, 6-month-old baby, their main complaint would be child is sleeping a lot and it is feeding poorly. So this also should be considered a symptom of COVID. Now, I know that most of you must be thinking that how do we differentiate this from the other common illness? So we come to our very, very important slide. That is, see, the part where most of our kids fall is this common cold group. So in the common cold group, most patients have lot of runny nose, they sneeze a lot, they have little bit of fever, and they commonly have loss of smell. Rarely they have little bit of body ache, but most of them is this presentation. While our COVID-19 patients do not have much of runny nose and sneezing. This is a very important point to differentiate from a common cold. Somebody comes with a lot of runny nose, most likely he's not a kid of COVID. He has lot of body ache and muscle pain, more likely to be COVID and less likely to be common cold. Now, how about you differentiate between allergies and COVID-19? While allergic patients usually come with again having a runny nose and common cold, this time around they have more cough and sometimes they also tend to have shortness of breath. So shortness of breath cannot be seen in common cold but can be seen in allergies. But most of our allergy patients rarely, I mean, in the beginning when they come, they really don't have much of fever. Their main complaint is respiratory. So more fever or high grade fever doesn't point towards a diagnosis of allergies. So I hope this makes it somewhat clear. So coming back to our case, Master Akshaj, we asked the parents, did you really find any difference in your previous episodes and this episode? The parents thought and they told, yes, sir. This time the Akshaj has a lot of body ache, and this time his fever is more than the previous ones. Last time, even when he had saturation of 90, he was breathing heavily, but he did not really have a lot of fever. So we told them, yes. We showed them this comparison and told his symptoms favor COVID-19. We tested him, he came out positive. Now, please understand, these are very, very, very common symptoms. So we cannot really tell that these are all sick kids. But there are some people who really need your attention. Who are these kids who need our extreme attention, our thoughtful counseling, and regular follow-up? Who are these kids? I'll explain this third case. This was our close friend, Dr. Nadav, who himself was COVID positive. He took his treatment. He completed his home isolation for 14 days. He recovered well. He was slightly elderly. He was a 16-year-old child. Again had these symptoms of fever, cold, and sore throat. She had mild breathing difficulty. But the very important point was that she was a case of renal tubular acidosis, which is a disorder of kidneys. Now, we advised them for home isolation. We gave them drugs. We asked them to keep a keen watch. What actually happened was, in the following days, her fever came down, her cough came down, but only complaint was that she keeps on vomiting more and she's slightly more sleepy. We called Dr. Nadaf to come to the hospital and get some primary investigations. Because she was a case of disorder of kidney disease, we tested her again for renal parameters. But this time, her urea and creatinine were sky high. So what was the important step which was missed? The important point is, let's understand, dear parents, dear friends, that certain kids, those who have pre-existing conditions like asthma, they have a heart disease, they have a kidney problem, they are a known case of malignancy, who are obese, type 1 diabetes, recovered from a major illness, immunocompromised, severely malnourished, these kids are danger signs. These kids need your attention more. You have to treat them with a lot of caution, keep a close watch, and regular follow up. Apart from that, any child, high fever for more than 2 days, be cautious. Very lethargic and sleepy, be cautious. Now, this brings us to a very important point, that is, you have to watch the urine output in these kids because they tend to get dehydrated very soon. Less urine output or dark colored urine is a point which you need to focus on. If somebody starts having breathing difficulty, dear sir, you are at the danger point. So, what actually happened was, she recovered well, but she had to require dialysis. So, please understand, these patients who have these red flag signs need to be watched and cared more. So, without wasting much time, we'll dwell directly into the management part. Now, this is a very complicated part for all of us doctors. That is, we cannot diagnose COVID alone with one investigation. What usually happens is, we see that a lot of COVID patients are tested heavily to a tune of 5,000, 8,000 rupees, and the parents are really wondering why so many tests are being done. Now, please understand, first thing is, identifying COVID is not easy. After identifying COVID, we have to grade it, whether it is a mild case, moderate, or severe case, and we have to monitor its effects on the body. So, because of this reason, lot of investigations are required. Now, this brings us to very important. One doctor close to me referred me a child with fever, cough, and tachypnea. He was a known case of allergic bronchitis, but this time around, he had a very high CRP. Now, the real question is, or no? Another doctor close to me, this time again, he referred a child with fever, which is lasting for over thoroughly with CRP, ESR, ferritin, which are all high. He called me, doctor, there is only one odd complaint, that is, this time the child has lot of joint swelling. Whether joint swelling fits into the COVID group? No. And the doctor called me telling that the child has fever and cough, no tachypnea. All of the family members are COVID positive. We got the CT of everybody, but this child has a cohorts of 0/25. Does this mean that the child is not COVID negative? So these are all valid questions. And through this next slide, I would like to explain when, whether, and how to test the children with COVID. First of all, I advise that if any child is being hospitalized or undergoing any procedure, please do the COVID test. Now, the earlier guidelines used to tell that at the earliest test them. That is because we can start treatment soon. So also we can advise the right duration of isolation. But newer and newer guidelines based on more and more expertise, we are seeing that if they are asymptomatic and they can keep a good follow-up, they can talk to you regularly, then we might not have to test them. We have to explain all the red flag signs which I have told you earlier. After explaining to them, please tell that any of these are there, come to us swiftly. So these children may not require your investigations. But the very important point is, All these patients must undergo a period of quarantine for 14 days. If they have symptoms not being tested, please tell them that you might recover well, but your child may act as a super spreader and infect everybody around. Your grandparents are at grave risk. So, please recapitulate all the symptoms which I have told earlier. These are the people whom we have to suspect and we have to test in the last slide. Now, what to test? The thing is, we have rapid test, we have a RT-PCR, we have a HRCT. Now, the thing is, your rapid test gives you swift result, but it is not a very sensitive test. So many kids who are negative may actually be COVID, but the test might show a negative result. Now, how about if it's positive? Is it really positive all the time? It's a very valid question. So, big research was done which showed that if your child has symptoms suggestive of COVID and your rapid test is positive, it is invariably a COVID. But if it is negative and symptoms are suggestive of COVID, this doesn't mean that the child is not COVID. In such children, we have to go to the more sensitive and more expensive test, that is RT-PCR. Now, RT-PCR yields better result, but it is not 100% also. Now, the very important point is that those patients who are undergoing RT-PCR have to wait for some time until the result comes. Sometimes we have seen that RT-PCR results have taken 6 days, 8 days to come, and treatment becomes impossible to wait for such a long duration. How about CT thorax? Now, this is a very, very important point, dear colleagues. The important point is that HRCT exposes or produces a lot of radiation, which is not good for the children. So, only in selected cases, that is, if you have a low saturation, if the breathing difficulty is very significant, or any child who is receiving treatment for COVID suddenly deteriorates, or his status is worsening and you don't know, only in such scenario, CT thorax has to be done. I hope the question regarding RAT versus RT-PCR versus HRCT is solved. What about CRP, ferritin? Now, dear colleagues, budding doctors, practicing physicians, please understand, these are all acute phase reactants. That is, they rise rapidly during any illness. It may be a viral respiratory infection, it may be a bacterial infection, it may be a rheumatological disorder, they raise. So, alone, these CRP and ferritin cannot be a marker. Yes, you are valid in testing people with raised CRP with a rapid test, but please don't disclose that, oh, your CRP is raised, you are a case of COVID. Please don't do that. If your CRP is raised, yes, you are a candidate for rapid test, not that you are a diagnosed case of COVID illness. I hope this is clear. Now, after having investigated them, we have to classify them based on whether they are mild, moderate, severe, or critical. Why is this so? Because based on this, we are going to give them the treatment options. All the symptoms which I explained earlier, they all fall into the category of mild disease. If the next part between moderate and severe, basically saturation. You see that saturation between 90 to 94, they fall in the moderate category. If saturation is less than 90, they're breathing heavily, they're grunting, they have a lot of retractions, or he's lethargic, he has a seizure. Dear friends, he's a sick child. This child falls into the severe category. What about the critical children? If they have an ARDS, that is the lungs are wiped out, they have shock, multi-organs are affected, or they have thrombosis, they belong to the critical category. They need your immediate ICU care. Now, so it all brings down to how good you are doing the pulse oximetry. Now, a lot of people are buying this cheap pulse oximeter which show very wrong readings. Please purchase a good pulse oximeter. While you are testing it, make sure you are rested. Don't come home running, afraid that, oh, you have been diagnosed with COVID, check yourself and you get a wrong reading. Don't do that. Please come down, calm yourself, rest yourself, use your index or middle finger, clean your nails if you're using a nail polish or for fake nails. Keep the pulse oximeter on for a duration of at least 1 minute. After doing so, you see that initially there is some fluctuation. After some time, this fluctuation comes down. Once the fluctuation comes down, you must see that there is a reading of 96, 97, 98, 99. Yes, the highest reading is the one which is your saturation. You might be showing between 96 to 99, but 99 is your saturation. So this is the most important point. Finally, please understand that one reading alone is not important. The most important point is you have to keep on recording this saturation at least 2 to 3 times a day for a duration of 14 days. Please understand the critical phase begins beyond the fifth day. What usually happens is they check the saturation for the first 2 3 days, and by the time they are in the fifth or sixth day, they feel that every day I'm checking and I'm getting good recording, and they deteriorate on seventh or eighth day. Now, the more important thing is the best thing to do is to do a 6 minute walk test. Check your saturation, do a brisk walk for 6 minutes, come back and check your saturation. If your saturation doesn't come down by 4 to 5 points, it means that you are safe. If it is coming down, then you are at risk category. Now, what actually happens is after having diagnosed, all of us face this very difficult scenario. So the family is positive, the child is negative. What to do? The child is positive, family is negative. Again, a difficult dilemma. Mother is positive, she's about to deliver. Very difficult question. Now, how do we deal with this? Now, I advise that first thing, see whether the child is a small child or a big child, whether he is sick or he is well, and also the more important point is what is the age and health status of the parents. If the child is positive and the parents are negative, and this family is a joint family, the best advice is to isolate the parent child group in a different house, in a different room, as much as possible, because the exposure to others comes down. The grandparents are spared. Now, if there are two parents who are caretakers, one should be assigned as the primary caretaker. Who is that? Say your father is a case of heart disease, he has diabetes, then the mother should be the caretaker. If at all the mother is diabetic or she is obese, then the father should be the caretaker. Only one person should be the caretaker. Whoever is caretaker, they should take care of their health also. Please understand that whenever you are traveling in a aeroplane, they tell that whenever the mask drops down, you first put oxygen to yourself and then put the oxygen to the child. Because if you are affected, you are the primary caretaker, again you are causing more risk to yourself. So they should take the universal precautions. Wear a mask snugly, wash hands frequently, whenever not required, maintain social distancing. Now, what happens is all of us have this thing that okay, the child is sick and he's not doing well. I have to go and kiss him, cuddle him. No, this time you have to maintain discipline. You have to, in the 14 days, you have to consistently check his saturation, check his temperature, and keep talking to your doctor as early as possible. If there are older children, say somebody who is 12 years or 14 years, 16 years, you can isolate them alone. For smaller children, should be isolated with one of the parents. Now, the very difficult scenario is pregnancy and COVID. Dear colleagues, it is noted that 2% of transmission is being noted. The risk goes up to 6% also, but on an average, if 100 positive women deliver, 2 kids are going to be tested positive. Now, the very important point is that the time at which COVID was diagnosed is far more important than the severity of COVID. Say a mother has severe COVID during her second trimester, the chance is less compared to a mild COVID during just in the third trimester. So all mothers who are listening to this talk, please take precaution. Advise precaution to your husband, to your family members. Avoid going outside. Avoid contact with others. Now, if at all your child is delivered in a health setup, the important point is that you continue breastfeeding the child. Even though you are positive and you have mild illness, please continue breastfeeding. No studies have shown that the virus is transmitted to breast milk. Yes, but dear mothers, you have to wear mask, you have to wear gloves, You have to wash your hands frequently, and whenever not required, maintain a distance of 6 meters again. But if you are sick and you're not well, you might express the milk and give it to the child. And the important point is that if your child is has been diagnosed as negative, you have to keep on testing it multiple times until a duration of 14 days. And you have to keep a close watch on him for a duration of 4 weeks. Now, after having understood all the various scenarios, the final very important point, how do we treat it, sir? What do we do? Now, the first part is, in the mild cases, the most important treatment is hydration, hydration, hydration. Because these kids tend to get dehydrated soon, like our Nadaf patient. They get dehydrated very soon. The treatment actually consists of very simple drugs as paracetamol. Please avoid using ibuprofen. Saline nasal drops is advised. All of the kids can receive multivitamins like zinc, vitamin C, vitamin D has also been advised. If it's a mild case, right now, no investigations are need to be done. Why? If you are a case who is a mild case, yet you have comorbidities, then preferably observe in a health setting or keep a close contact with your doctors. Please understand that since the COVID symptoms are similar to other illness, those who are having fever for more than 3 to 4 days, they also need to be ruled out of other illness. If you are falling into moderate category, this time we do a panel of tests like CBC, RFT, LFT, chest X-rays, CRP, and we keep on repeating it every 2 to 3 days. Treatment again consists of hydration and paracetamol right here. If your saturation comes down below 94, yes, the alarm is struck. Start oxygen. These are the kids who require IV steroid therapy. Now, if the lungs are really badly affected, such kids may require remdesivir administration. Now, please understand, even children who are 3.5 to 40 kgs can also receive remdesivir. Earlier, only the adults were trials were there, but now more and more children are receiving remdesivir in a younger age group. On the day one, we give 5 mg. The following days, we give 2.5 mg. Please understand that remdesivir should be used within a 10 days onset of symptoms. After 10 days, the value of remdesivir is less or maybe of no use also. How about antimicrobials? Please understand that it is a viral illness. Not all patients require antimicrobials. But yes, if you're suspecting a secondary bacterial infection, he is a patient with comorbidities. In such scenario, amoxicillin, clavulanate, or ceftriaxone are the drug of choice. We are seeing that a lot of patients are being put on piperacillin tazobactam, meropenem. Yes, this is unnecessary. It may be required for all those severe patients who are critically ill. Now, how about those who are critically ill? These require far more investigations like arterial blood gas, lactate, ECG, cardiac markers, and we may have to repeat it twice a day or daily. Such patients may require prone positioning. Now, please understand, prone position should be done during awake period. Proning is not something that you sleep in a prone position. Awake proning is advised. This helps in better breathing pattern. Such patients should be started on enoxaparin, that is, in a dose of 1 mg per kg for more than 2 months. For less than 2 months, 1.5 mg per kg. And we have to keep a watch whether they can progress into ARDS, kidney injury, heart myocarditis. So I hope we have clarified about how do we approach the treatment of COVID in children. Now, coming to the next most important point, that is, how do we, in the mild cases, we advise quarantine. Yes, right now, this is one of the most important solution. The kid with the family should be quarantined. So the question comes is, how long should we quarantine? Now, please listen carefully. 10 days after symptoms onset, say for example, you have a symptom today, for the next 10 days, you have to quarantine or isolate yourself. After you isolate yourself, please make sure that you have no fever for at least 3 days. See, on the 10th day of your isolation, you had a symptom of fever. 3 more days you have to spend in isolation. After you have finished also your isolation, next week you have to be careful and self-monitor. Earlier we used to tell that a negative test is very important to come out of home isolation. Right now, it is not being advised. You need not get a RT-PCR to come out of home isolation. So, if your PCR test is done today, isolate for 10 days, 11th day you can come home. If your symptoms start on 10th day and after finishing 10 days isolation plus 3 days isolation without symptoms, this is someone who had a positive PCR. So such patients will go for 14 days. So this is very important slide. Now, Dr. Saurabh requested me to tell who are the patients who require admission and referral. Please understand, all those patients who have a respiratory distress, low saturation, poor pulse, not taking well orally, very lethargic, or throwing a seizure, or having a comorbidity, these are all patients who require hospitalization. Then, what about who requires ICU admission? Those who are having ARDS, those who have severe shock, who have altered sensorium, who have multi-organ failure, these patients require ICU admission. Now, very important point to bring about that steroids, that is prednisolone, is being overused, abused, badly being used. Please understand, this is a very important slide. All those who of your colleagues who are receiving treatment, they should not be offered prednisolone in the first 5 days, because if you do so, it will delay the clearance of virus and make you more prone for a cytokine storm. Steroids should be given between 5 to 14 days for those people who are having low saturation and should be given in a hospital setting only. Now, please note that this black fungus is on rise. We don't know the cause. Steroids, remdesivir, oxygen, zinc have all been blamed. So using the right drug at the right time is what is most important. Please understand, zinc and vitamin C in children are a OD dosage. Zinc is given for 2 weeks, vitamin C for a 1 week duration. How about anticoagulants? Not all kids should be put on anticoagulants. How about favipiravir, remdesivir, tocilizumab? Please understand, none of them have been proved to be effective in children. So no azithromycin, no ivermectin for children. More so, no ibuprofen for kids. What is happening is, day one, child comes to you, fever, paracetamol offered. Day two, not coming down, ibuprofen offered. No, these kids are prone to acute kidney injury. So please, dear budding doctors, practicing physician, avoid using ibuprofen in the children. Very important point is, a lot of people used to use this hydroxychloroquine, and if you use it with the who has shock, who has myocardial dysfunction, who has a valvular, who has a cardiac problem, a coagulopathy, he has raised CRP, ESR, or and we have proved that he doesn't have any other bacterial infection and evidence of COVID-19. Sir,
Sir, you have exited from the meeting. Please rejoin.
is it, sir? Okay.
Yeah.
Yeah. How about now? Hello? No? One second. Okay. Cut out. Uh, okay. Okay. So that's about it. So we have covered most of the parts of the presentation. Last very important point is regarding COVID-19 vaccination. Now, so many companies are trying to bring out this vaccine. Right now, no vaccine is available for kids. The Pfizer vaccine, 12 to 15 years, is being tested. Our Indian vaccines are patenting it for younger children. Right now, no COVID vaccine for children. Can we really prevent COVID infection in children? Please understand that if we follow the norms of SMS, that is the best mantra to prevent COVID. Adult vaccination is another very important point in preventing COVID in children, as your parents are the primary carriers. So this brings us to the last part. What are the do's and don'ts? For all those who are practicing doctors, please understand, during your OPD practice, we have to wear mask and shield. We have to advise this to the patients also. We have to frequently wash our hands. We have to clean our stethoscope frequently. As much as possible, transfer it to telephonic consultations. If they are coming to hospital, triage them. That is, all the febrile patients, check the temperature, check saturation, bring out these patients in a separate group. If you really know that, okay, these are patients who are COVID positive family contacts, call them at a different timing. If you're a pediatrician, keep your immunizations to a separate timing. Let all patients who come into OPD be checked with pulse oximeter. As much as possible, avoid checking on the bed. If it's a small child, let them be carried in mother's lap. If it's a slightly bigger child, on the shoulders of parents or standing. As much as possible, avoid auscultating on the chest. You can auscultate on the back. Preferably avoid examination of the throat during this time. So all those who are young doctors, we have seen that so many doctors have lost their life. So many young doctors who are learning doctors, because of lack of knowledge, have lost their lives. So it's a very important slide. Please pay attention and follow these precautions. Now, what are the don'ts? Please don't advise any prophylactic medication for children whose parents are positive. There is no proven drug as per WHO having any prophylactic usage. A lot of patients have been, because of respiratory complaints, are being given nebulizations. What is happening is this same nebulizer used into another patient may transfer the COVID in them. So avoid using nebulizers. If it is must and should, use a meter dose inhaler. That is single-used one. Use meter dose inhaler. If unless it's a case of asthma, avoid using Budecort, which is being rampantly used. Avoid using unnecessary steroids. There is no role of BCG or MMR vaccination. It is not being proved. Methylene blue, again, another drug which is being rampantly used, has again no role. Another important thing is do not use remdesivir after 10 days. So I think this brings us to our end of our presentation. So finally, I just want to tell the 10 most important points of the presentation. If you have not attended and you joined in late, or you could not keenly listen to it, please listen to these 10 statements. First thing, kids with fever for more than 5 days are high risk kids. CT in the first 5 days of illness gives you a wrong feeling of mild disease. You might get a correct score of 2 or 3. Later, the disease progresses. So CT should be reserved for beyond 5 days. Steroids should not be given in the first 5 days. Hydration is the key. All your mild cases and your OPD or home isolation cases should be stressed on hydration. All patients who are started on steroids should not be abruptly withdrawn. It has to be gradually tapered over a duration of 2 weeks to 2 months. All patients in home isolation must do a 6-minute walk test. Please, friends, 6th to 12th day is the period of critical illness. So if you are okay for the first week, don't relax. Don't feel that you are okay. Whenever saturation, even though saturation is okay, but if your heart rate is more than 110 when you're resting, this again is a sign to bring to attention to the doctor. Now, all of us doctors are seeing false positive idols. All patients are being treated for typhoid fever. Suddenly they worsen. It was being diagnosed as typhoid and it is sick. No. There is cross-reacting antibodies of COVID which give a false positive idol. So any patient who is being treated for typhoid fever, think twice, think doubly. And last and the most important point, please all, let's have faith. We have to have faith that, okay, I'll do well. I am fit. I'm going to come across this. Please now see that so much of remdesivir was produced and it was all fake remdesivir, yet it worked. So even fake remdesivir worked because they had faith in the remdesivir. So having faith and telling that all will be well is the mantra. I hope I have clarified most of your doubts. Dr. Saurabh, this is the end of my presentation. If there are any questions, I'd be glad to take it.
Yeah, our another Dr. Narayan will raise the question, sir.
Yeah.
Please hold on. He'll just check out and select few questions and ask.
Until he's selecting, I'm just doing some very brief 2 minutes of myth busting. That is, are antibiotics effective in treating COVID patients? No. No antibiotics will help to treat COVID patients. Very important question people are asking is, we are ordering stuff from Amazon, from Flipkart and everything. Can they bring COVID if they are being transferred from those countries where COVID is high? Please note that COVID cannot survive for a duration of such long period. So no, COVID cannot be transmitted through goods. A lot of patients keep asking me whether mosquito bite can cause, a neighbor has COVID, mosquitoes bite him through blood, can it come to me? No. No documented case of mosquito transmitting COVID. Some people are asking, can we drink alcohol to prevent COVID? No. Alcohol is not going to help you prevent COVID. People tell that, okay, it's summer now, so COVID is going to come down. No, sir. COVID is there in the most harsh climates. It's there in the coolest countries and in the hottest countries. People are using UV bulb to cleanse their notes, wallets, masks, etc. But you cannot use UV light on yourself. Please don't do that. Can eating garlic prevent COVID? No, sir. Garlic is not proved as per CDC to be used for COVID-19. Finally, people are doing this nasal rinsing. They put lemon in the nose and all those things. Please don't do that. It is high risk. Rinsing your nose can prevent cold, but no, COVID cannot be prevented from this condition. Hydroxychloroquine does not prevent COVID-19. Your vitamins can increase your immunity, but cannot prevent or treat COVID-19. Very important point. Please, when you are exercising outside, please don't wear a mask while exercising. And another important thing is that, no, if you are wearing a mask, it is not going to cause oxygen deficiency or carbon dioxide intoxication. Right, sir. I'm done with this presentation.
Thank you very much, sir, for a brainstorming, very informative webinar. There are a few questions which are posted on YouTube. I'll be reading out one after the other. The first question is from Dr. Pallavi Kulkarni. So the question is, can a pregnant lady get vaccinated? If yes, when she should get vaccinated? And how about vaccination for the newborns?
Dr. Pallavi, it's a very, very important question. First part is regarding vaccinating of newborns is not possible. Right now, there are no trials which are considering it safe in newborns. Yes, for pregnant women, now, please understand that right now there are not enough research to recommend vaccine in pregnant women. But the authorities like Foxy, CDC, UK organizations are all advising that pregnant women must be offered COVID vaccine. Now, I'll just bring out the salient point. First thing is, if you are predominantly staying at home, you might avoid it. If you are in a high risk group, that is, you go to hospital, you are a health worker, you are a frontline worker, you are in a job where it requires a lot of client interaction, the risks outweigh benefits and you have to take the vaccine. First thing. Second thing, even those who are not in this category must be offered the vaccine. And what was seen that those patients who received the vaccine and had accidentally become pregnant, they did not present with any major side effects. So right now, I and other organizations recommend vaccination in pregnant women. Now, second question is timing. The thing is that during your first trimester, there is ongoing organogenesis. So at this time, if you have fever or you become lethargic, it might affect a little bit. So right now, it is recommended that second trimester is the ideal time to take your COVID vaccine. If you are in the third trimester, you don't need to wait. You can take the vaccine. Second trimester, third trimester is all safe. And your last part, whether vaccinating your newborn, if you take the vaccine, you produce antibodies. These antibodies will be transferred to your baby, and they are passively vaccinated. So I hope this answers your question. Narayan sir.
Yes, sir. The next question from Dr. Sharath. The thymus gland in children, does it have any role in the immune response for the children who are positive?
Yes, there are some products which are like something called as thymosin alpha, which are being produced to help in treating of COVID patients. Please understand that thymus is an organ which produces a lot of these immune cells called T cells, which have a positive role in improving your immunity. That is the very reason because of which young children by far during all these days were protected against the virus. It will continue to do so because children will have thymus, will have active immunity, will have taken vaccine, will have higher amount of antibodies, and will continue to be safer compared to adults in the years to come. Yes, Dr. Narayan.
The next question is from Dr. Abhishek. What is the best time to advise RT-PCR test in children?
Dear sir, the thing is, once you are symptomatic, invariably you have the virus has come to a level where it can be identified. It is told that if you are in a family who is exposed and you are asymptomatic, day 3 you have to get your first RT-PCR. If your first RT-PCR comes negative, you wait for 48 hours and get your second RT-PCR. So the ideal timing is symptomatic, do it today. If you are asymptomatic and you are just a contact, then 3 days within the limit, and 48 hours you can repeat if it comes negative. Yes, Dr. Narayan.
Question is from Dr. Kalyan. He's saying, what are the prognosis of the children who are COVID positive and who are suffering from other comorbidities like juvenile diabetes or nephrotic syndrome and other morbidities?
Sir, it's a very valid question. And right now what actually happens is that because the number of patients who have been diagnosed with COVID is a very small number, it's really difficult to answer your question as a statistical point of view. That is, I cannot give you the exact figures. The very important point is overall, if 100 kids are diagnosed with COVID, 90 will be mild symptomatic, 5 will be moderate symptomatic, maybe 3 will be severe and 2 will be critical. So largely only 10% kids might become moderately sick. Among the patients who are having comorbidities, based on the comorbidity status, that is uncontrolled diabetes, if he has severe obesity, and if he is immunocompromised, he is a cancer recovery patient, they all have higher risks. But telling that, okay, they have 20% higher risk or 30% higher risk is really difficult. And only more and more studies in the next year can give you the exact figure. So I can tell you that all patients with comorbidities need to be watched with utmost caution. Now, I can tell you an example. We used to tell that regarding genetic testing, say it is autosomal recessive condition and there are 25% risk or 50% risk. What this 50% means is that every child has 50% risk. That doesn't mean that 4 kids are born, 2 kids will be affected. It's not that. Every child has 50% risk. That means that, say the chance risk is 10% or 5%. We don't know who falls into this 5 or 10%. So every patient has to be given utmost care and utmost caution. So I hope this throws some light into your question. Narayan sir.
Yes, sir. The next question is from Dr. Basavaraj. Can a COVID positive mother breastfeed the child?
Sir, as I explained in the slide, the thing is, right now, what is seen is if you don't breastfeed, the risks are higher than with breastfeeding. It has been studied well that breast milk is not going to transmit the virus. So all mothers should be advised that they can breastfeed. They have to frequently hand wash. They have to wear a good mask. They don't need to wash the breast. They have to maintain a 6-meter distance whenever they're not breastfeeding. All this is for those who are mildly symptomatic. If the mother falls into a moderate symptomatic group, then such mother can express the milk and some caretaker can give the expressed breast milk. If she herself is badly affected, then there is no question of breastfeeding. Narayan sir.
Okay, sir. And the next question is from Dr. Aisha Mullah. Is it safe to give steroid for children? For how many days? If it is so, for how many days can be given? And in adult COVID patients, is it safe to give steroids for 7 to 10 days?
Dr. Aisha, it's a very valid question. Please understand that there are some very important guiding principle in usage of steroids. One thing is, steroid is a double-edged sword. That is, you use it more, it causes more damage. You use it less, it causes more damage. We understand that COVID is more of an autoimmune disorder rather than an infection. A lot of kids get affected with COVID virus. Later, their own immunity kills them. So steroids play a major role in treatment of COVID. First principle, do not use steroids in the first 5 days. If you use it during the first 5 days, viral application is delayed, cytokine storm chances are more. So no usage of steroid in the first 5 days. Usage of steroid should be restricted for a select population who are hospitalized, who have saturation less than 94, who have breathing difficulty, and CT showing bad lung disorders. So these patients should be offered steroid. Steroids will be used as per the clinical condition guides. Steroids cannot be abruptly stopped. Third important point is should not be abruptly stopped, should be gradually tapered over time based on the clinical condition. I hope this answers your question. Narayan sir.
Yes, sir. Next question is from Dr. Shweta. Nowadays, we have seen that COVID cases who go on to ventilators have a bad prognosis. Is the same with children also?
Yes, sir. Yes, Dr. Shweta. Those patients who are going on ventilator invariably have bad prognosis. There are two reasons. One thing is only the bad and sick patients go on ventilator. Second thing is right now the norm is non-invasive ventilation is the treatment of choice. Invasive ventilation, because a lot of pulmonary thrombosis is there, the alveolar collapsed. Really, invasive ventilation is a challenging thing, and it has to be left in the hands of those who are really expert at managing this. So the important message to take home is that even in kids, those who are going on ventilation, the prognosis is not good. Yes, sir.
Thank you, sir. Okay, and the next question is from Dr. R. Patil. Do you suggest child should get vaccinated with influenza vaccine?
Yeah, sir. It's a very important question again. One thing is the Maharashtra government recommends influenza flu vaccines for all the kids. Various governments are into the process of bringing this as a guideline. There are three very important reasons why influenza has to be given. One thing is, now that we are entering the third phase where there are a lot of kids being affected, uh, kids who receive influenza vaccine, which is again a viral vaccine, have some kind of protective role against COVID. Not that it is like a COVID vaccine itself, but it has some kind of protective role. That is one established fact. Second established fact is that, sir, if your child has any respiratory problem, what will invariably happen in the coming days is that they will be admitted to COVID ward first, because we until the diagnosis is proved otherwise, any patient with respiratory problem may have to be admitted in COVID ward. So it's a grave risk. Third thing is, flu can also present like a COVID illness itself. At least you eliminate this risk of flu or influenza in the children. So considering these three important points, it is important that we have to and must give flu vaccine or influenza vaccine to as many kids as possible. Narayan, sir.
Yes, and the next question is from Dr. Anand. If all the adults are getting vaccinated, can children stay away from vaccination?
Sir, it's a very hypothetical question. The thing is, we are at a very foot long distance from all adults getting vaccinated. Thing is that universal coverage of vaccine is a dream. If it really happens, then maybe your question has some validity. Right now, as many as possible, let's vaccinate all the adults. And right now, there are no vaccines for kids. If they do come, we still advise that let them also get their primary immunity. It's like, because everybody else is wearing masks, should I not wear masks? No, you also have to wear masks, and they also have to wear masks. Let the adults be vaccinated, let the child be vaccinated. Let them have their primary immunity. Narayan, sir.
Yes, so there's a question out of the box, but an important one, and I think most of the viewers might have this question. Recently, a Nobel laureate gave statement that those who are getting vaccinated with COVID-19 vaccine will die within the next 2 years. So, what is your view on this, sir?
Sir, it's a very false story. What he said was that if we vaccinate everybody, what we're actually doing is we are producing more and more strains which will become more and more virulent. These are his words, that if we vaccinate the people, everybody is vaccinated, the virus has to survive. So it will survive in the way that it becomes more virulent and more dangerous and more aggressive. That is what he has said. Myself, nor any of the major agencies, organizations do not support this statement. Sir, Narayan, sir.
Yes, sir. Thank you, sir. I think most of the questions are covered, sir, and there are many questions which are repeated. So I now call upon Dr. Saurabh, sir, for the vote of thanks.
Yes, sir.
Hello.
Sir.
Yeah. Thank you, Dr. Sachin, sir. And I'm most thankful to see Dr. Pramod, sir, also with the meet, as well as you two for the long time. Even Sumera madam also has joined. Very pleased to have all of you, all Miraj family, in our platform and getting our viewers and audience members enlightened with COVID pandemic knowledge in children's prevention and home care. Very, very thankful to you for this wonderful presentation, sir. Keeping your busy schedule away with running neonatal ICU in Athani City. You are taking out time and giving lectures regularly to educate public as well as budding doctors, faculties, and children. Thank you very much, sir. Thank you for presenting with us. Thank you. We'll have more and more talks with you at our platform. Very, very pleased to have. Thank you, sir.
Thank you, sir, for giving me this opportunity. Yes.
Yeah. Thank you, sir.
Right. Thank you.